the recoil action of the vessel as the blood flows through. And when you lose that recoil, the shock of the heart pulse from the aorta coming all the way down, that goes all the way through the vessel, and if it doesn't absorb with the elasticity, it hits the end and it comes back again. And that shock wave becomes a part of the patient's health picture, and it can be dangerous.
Wow.
So,
Okay.
we want to be able to help the patient's health and avoid those kinds of circumstances.
That's great. So what's the name of this machine and what is this test called?
Well, this is the name of the machine is called the CV Profiler. It's through a company out of Minnesota called Hypertension Diagnostics Incorporated. And they developed this machine through the help of a cardiologist at the University of Minnesota. If you look at all the critical research that was done with arterial elasticity, how it's an excellent marker, even better than a calcium score, predicting future heart attacks. This is the device that was used. And so I'm not just doing an arterial elasticity test, I'm using the device that was used in the research, so that I think we've got a really good assessment here. And I just want to be careful what device I get so that I have a true representation of what the peer-reviewed literature says versus what I'm finding in the patients.
Yeah. So
Okay.
very. Welcome back, everyone. It's Mike with High Intensity Health. So glad that you're with us today. We're going to talk about advanced cardiovascular risk assessment with my good friend, Dr. Scott Vanderwielen today. So we're actually going to do a diagnostic assessment. But before we do, we're going to get to know Dr. Scott a little bit better and talk about this advanced test. So how are you doing today?
I'm doing fine, Mike. Welcome to Wisconsin.
Thank you for having me.
I know
Good
you
to be
came
here.
quite a distance to get here, so thank you.
Yeah,
And it's a pleasure to talk with you.
absolutely. So, Dr. Scott, a lot of patients are doing advanced lipid testing, looking at HDL, LDL, which doesn't tell the whole story. We're actually going to do a real live test, look at the health of the skin of our arteries called the endothelium. So let's talk about that. And,
Sure.
Yeah.
Well, what we look at and what we're concerned about, we can look at this graph here. If we are concerned about endothelial dysfunction, it's the yellow slot right here on this vessel. And this vessel represents the different stages of a diseased vessel. The first stage is going to be endothelial dysfunction. There is no structural change in the vessel. It just doesn't function well. The second change is that right here in this zone right here is when it's called the C2, or we call it a loss of arterial elasticity of the small vessels. That is the first structural signal where it changes, where we can say the disease or the process of the vessel being diseased is more progressive. It's progressing towards further disease. And so what we are looking for is the reduced arterial elasticity, if it's there or not. And when we take that measurement, we will know where along the spectrum the disease process is in the vessel. Now, I'm a student of the Institute for Functional Medicine, and I do what I'm taught. And my rock star is Dr. Mark Houston, okay? And he's the one that really taught me as a student all that I know about this cardiovascular test and how I approach the cardiovascular part of a patient's health.
Yeah.
So I want to give him credit for that. And what we want to do, though, is when I do this test, if I have endothelial dysfunction, I'm going to find it. But I'm going to find it in the structural change in the vessel.
Okay.
All right. And so how does the lipidemia or dyslipidemia enter into it? Well, naturally, the HDL is referred to as reverse transport. And so if we can have strong HDL levels, we know we have what's called reverse transport, where the liver is receiving all the HDL to receive all the fat being displaced from the vessels back to the liver so that the liver can dispose of them. And that's also a player. But Mark Houston, again, Dr. Houston told me, he pointed to me on a one-on-one discussion, and he said, Scott, may you never run a standard lipid panel on a patient ever again. And so, I'm like, yes, sir. And
Right.
so from then on, I stopped testing the standard lipid panel because it does not tell us what we need to know. If we look at the top 5 risk factors for cardiovascular disease, there's smoking, obesity, diabetes, hypertension, and dyslipidemia. And 50% of the patients who have a cardiovascular condition have normal levels of those 5 factors. And so we are at the edge of what can be done in terms of testing those 5 categories. And that's why the endothelial dysfunction test that we do here is really a good insight into where we are to detect the things that need to be detected in a patient's health picture so we can help them. And they won't fly under the radar like they would with those 5 risk factors I mentioned before.
Perfect. So this gives us a much more accurate diagnosis or assessment of our arterial or vascular health.
Exactly. Exactly.
Now, as Dr. Marcuson has taught me, he's been a great mentor to so many of us.
Maybe his ears are ringing right now. Yeah.
We have we want our vessels to be like a hose, kind of supple, not like tin pipes.
Right.
So this test will actually look at that and tell us if we have, aged vessels or, damaged vessels or that supple hose-like vessel. Is that what we're looking at?
That's right. And he talks about the the recoil action of the vessel as the blood flows through. And when you lose that recoil, the shock of the heart pulse from the aorta coming all the way down, that goes all the way through the vessel. And if it doesn't absorb with the elasticity, it hits the end and it comes back again. And that shock wave becomes a part of the patient's health picture, and it can be dangerous.
Wow.
So, we want to be able to help the patient's health and avoid those kinds of circumstances.
That's great. So what's the name of this machine and what is this test called?
Well, this is the name of the machine is called the CV Profiler. It's through a company out of Minnesota called Hypertension Diagnostics Incorporated. And they developed this machine through the help of a cardiologist at the University of Minnesota. If you look at all the critical research that was done with arterial elasticity, how it's an excellent marker, even better than a calcium score, predicting future heart attacks. This is the device that was used. And so I'm not just doing an arterial elasticity test, I'm using the device that was used in the research so that I think we've got a really good assessment here. And I just want to be careful what device I get so that I have a true representation of what the peer-reviewed literature says versus what I'm finding in the patients.
Yeah. So very medically validated, scientifically validated.
Yes.
Now, let's say hypothetically patient A comes in and they have endothelial dysfunction, where the elasticity is not there. You put them on your protocol, which would be real food, sleep, stress reduction, all the functional medicine-based approaches. What have you seen, or how quickly have you seen improvements in their arterial elasticity?
Well, one thing nice about this test having it in office is that we can retest whenever we think we need to. And as well, the sign on the sign outside side says Diagnostic Center. I'm not a testophiliac, so I will test maybe in 3 months, maybe in 6 months. I'm looking more closely at what the patient is doing every day, and in terms of helping them get better. And we use the objective data to either demonstrate to the patient that the path they're on is not going to take them to a good place, and we can confirm for them that they really aren't spinning their tires if we do decide to retest in 3 to 6 months. And along with the lifestyle choices and so forth, we put them on the CoQ10. We put them on the R-lipoic acid, and we put them on the nitric oxide boosters to help the vessel repair. And so we find we get a lot of improvement on them, and it's not dramatic. It's a practice of healthy lifestyle choices day in and day out that is going to get the patient there. And when they see that it's improving, and it's a lifestyle that they can find joy in their heart with, we have a winning situation here. Because no one wants to be miserable trying to make the right food choices and so forth. And so we have to work with them and put them on a plan that they feel good about, because I'm not a doctor dictator. It's really a partnership that we establish with the patients that enable us to find success with them.
I love that. And you mentioned the other tests that are out there, like CT scan. This is wonderful. It's non-invasive.
Right, and it's not invasive. There's no injection of any kind of radiolucent material or anything like that, and it's excellent. I mean, the peer-reviewed research shows this to be an excellent test where I really couldn't ignore what this information would give us from the patients. So I'm delighted to be able to offer it to the patients. And in Wisconsin, even though the company's in Minnesota, I couldn't find another office in Wisconsin that offers this test. That's too bad. I mean, it's a good test, and whenever I have presentations, I do talk about this. A patient will raise their hand and say, well, why doesn't my doctor do this? And I can't explain why your doctor does the things He does.
Right.
But we do it here.
Yeah, that was my next
know?
question, actually. With heart disease being the number one cause of mortality in the world, not only the U.S., such a non-invasive test that you can reproduce and it's scientifically,
Right.
why wouldn't other practitioners do it?
Well, I'll tell you, I met with the company and they explained to me what the problem is. Okay, and it's not a problem for us, but there is such a processed, automated healthcare environment now, where they want to get the patient in, process them, and get them out the door in 15 minutes, and have the whole plan taken care of, which is the opposite end of how we do things. But to put the test together, and you'll see there's micrometer adjustment on the sensor where it's placed on the blood vessel in order to get the acoustical reading on it. That takes a little finessing.
Yeah.
And in the bada boom, bada bing world here, in healthcare, it really is a counterculture kind of test. It's a change of pace for what they're accustomed to doing, and so the machine winds up sitting in a corner.
Yeah.
With that. And unfortunately, it's an excellent test, and it's not done, mostly for that reason.
Interesting.
Yeah.
So this is where your engineering background comes in, because you like the little trinkets and so forth. I see that.
I like the objective data and evaluating a patient's health. And the joke is, what happens when a mechanical engineer becomes a chiropractor? Right? He winds up with the Health and Wellness Diagnostic Center.
Right.
So I guess that's the joke here.
Yeah, that's great. No, it's awesome. So we're actually going to do a test on myself. Is that right?
Yes, and we have Heather. She's my medical assistant, and she's an expert at providing this test. And we're going to bring her in here. I'm going to yield my seat so she can work with you.
Perfect.
And what the test involves is, number one, you can't talk during the test because the sensor. I failed the test by just saying and that was enough to fail the test. So you won't be able to speak during the test. And there's an automated blood pressure taking. And Heather will find the radial pulse wave, and then it will show up on this monitor right here, and the actual pulse wave with the dichrotic notch, and you'll be able to evaluate that, and the report will be printed, and we will get our C1 and C2 levels for the large vessels and the small vessels, and we'll know what kind of arterial elasticity you have, and it will break it down by age, so we'll know where you are with your age. Okay.
I love it.
All right. She's feeling where the pulse is, and she's X marks the spot where she felt the pulse with her finger. What she's doing is she's threading a screw on that to control the pressure force of the sensor diaphragm against the outer skin where the vessel is. And so with the right amount of pressure, we will get a good reading of the actual acoustical sound of the blood rushing through the radial artery. So that is the acoustic reading, sound of the blood rushing through the radial artery on the right hand. And we can see this notch right here. And that, with the position of that, with the slope of the line coming down, and the area underneath the curve here, it is all part of the calculation involved with determining the arterial elasticity of the small and large arteries.
I'm still alive.
Yes.
Non-invasive didn't hurt.
Was that painful?
No, not at all. All right, Dr. Scott. So how bad am I?
Well, for a 32-year-old, I'll show the zoom in on the table here. We can see that it has male and female, and it has the ages going down, and the large artery and then the small artery along with the values. And for your age, can we talk about your age here?
Yeah, let's do it.
Okay?
Yeah, we can
Okay.
be honest here.
On the front, it gave us your height and your weight. We asked you all these questions if you have any kind of familial history of cardiovascular disease and so forth. These were the questions that we had to enter into your data file on this test. And your systolic blood pressure was 121 and your diastolic was 67. So you're 121 over 67. Your mean arterial blood pressure was 90. Pulse pressure was 54, and you were at 63 beats per minute. All right. Now the large artery elasticity index was 19.4, and the small artery C2 number was 10.2. So if I go on the flip side here, for your age, we're 30 to 39 and you're 32, the large artery elasticity, we want to see it over 14, and you were 19.
Okay.
So for your age group, you're really good. And if we go in the younger age scales, what we're seeing is that you have the blood vessels of a 15 to 19-year-old for your age. So you're a testimony to how healthy lifestyle choices is slowing the aging process for you. And so that's good. For the small artery elasticity, When vessels are going to deteriorate, they're going to deteriorate at the small vessels first. So the C2 becomes the more important number. And you were at 10.2. And for your age range, we want to see it over 8. So you're well above that. And in fact, the 15 to 19 range has 9 as being the normal, the normal entry level for that. And you're at 10. So you're at a 15 to 19-year-old for the small artery elasticity. So I can safely say you have no endothelial dysfunction, no early warning sign of any kind of blood vessel concern in your health picture.
Cool.
All right?
So I don't need to quit smoking cigarettes.
No. That's right. We won't tell anybody, right? It's our secret.
Great. That's awesome. Good news.
Yeah. And, as a part of the overall health picture, this becomes important.
Yeah.
Because if I can reiterate what I was taught, was that the blood vessels are the innocent bystanders in any kind of disease process. And when, we would want to layer this in a health picture assessment from the cardiovascular picture. We went on to do the lipid protein particle profile, high sensitivity C-reactive protein, a detailed physical exam, and a detailed medical history.
Okay.
And assess the kind of any information that's going on in the patient, and then take the appropriate action for that.
Sure.
So we don't treat tests, we treat people, but we use the testing data to help fill out the patient's health picture so we can get a very clear assessment of what's going on with the patient.
I love it.
Okay.
Fantastic. So keep doing what I'm doing, which is working out 5 days a week, hiking, stress reduction, heart math, sleep.
Well, what do you have for breakfast, right? I mean, that's the foods you eat, right? And your stress life, all those things that you talked about are important.
Perfect.
And you have to, as doctors, and for all those other doctors who are listening here, in this clinic, and I can only speak for this clinic because I run this clinic, is that we have our patients address their own lifestyle concerns, and we do it together. There's no condemnation for whatever decisions they're making because they need to have security in what they've done in their past. And we recommend diets that they may seem to be restricted for them because there's not going to be any junk food in them. All right, limit the sugar, and we're going to show them the health benefits, and by showing them objective data, it becomes very demonstrated to them just where the decisions have led them to be. But in this office, we have to walk the talk too.
Yeah.
All right, patients can't see their doctor going through the drive-thru at Burger King. All right, you're just going to lose all credibility. And so, when we're at the grocery store, my wife is the office manager here, so the patients know my wife. And we go to the local grocery store in town here. We run into patients all the time. And they look in our shopping cart. Yeah. And my wife says, go ahead and look, okay? We know we have to walk the talk, and we know we have to be an example. And so I think it's hard for people when they make these lifestyle choices and they're changing the channel. They got to go to the grocery store, and now the rubber meets the road. What are they going to put in that cart for them to eat? So we're there. Look at what we get in our cart, okay? It's okay. I mean, if it's good, if it's in our cart, it's probably okay for you to get to. Yeah. Okay. And so I just want to stress that if you're not walking your talk as a functional medicine doctor, that's a good place to start before you start speaking to other people's lives about what they need to change as well. Okay.
I really agree with that. And along those lines, you went biking this morning. You're in your bike gear, your bike shirt.
Yes, I did.
You and I have been biking before when we talk and do stuff. And you have some polyphenolic-rich blueberries in the other room that I saw you were
I bought 2 bowls and one for each of us so that we can have a snack while we meet. Yes.
Yeah. I wonder how that would have affected this test if I would have had some of those before, because I know that has a good... Right.
I think it would have been fine. What affects this test immediately? My father, who's 80 years old, came in, and I'll just mention that I take care of both my mother and my father's health. My father's 80, my mother's around 76 or 77. And neither of them are any kind of meds. I got him on a fish oil. I've got my father on a few things. And I did the arterial elasticity on him as an 80-year-old, and it wasn't good. All right, his small arterial elasticity wasn't good. And it was the first time I had tested him. And so I went ahead and I put him on CoQ10, aliporic acid, and nitric oxide boosters. And we're going to be retesting probably in January.
Cool.
And we'll see what that looks like. So, but they actually listen to their son. And, we're told in school, never be a doctor to your family because no one listens to you.
Right.
Well, my parents are the exception to that. They really do listen to me, and the fish oils, and also on the vitamin D and all that. And they're not in any kind of meds, and their friends are struggling with their health, and the deterioration is there, and my parents aren't slowing down. They're involved in 2 different churches, choir directing.
Wow.
And they love what they're doing. And so, I just want to mention this from the Blue Zones book in terms of what makes the Centurion lifestyle, what kind of components need to be there. And they do belong to something bigger than themselves. And they are not retired by any sense of the word. And so I call over there at 10 o'clock at night and I can't get a hold of them. They're not home yet.
Wow.
Okay? So I'm just saying, walking your talk is important. And I think my father's example, my mother's example, it's a good example of what healthy aging should be like too.
Mm.
And I'm grateful for that. Yeah.
Well, that's great. And it's more than just supplements. Like you mentioned, the lifestyle, the diet, the purpose.
Right.
Well,
I like what Dr. Bland has to say about that. We want to be able to get our nutrition through food. But food isn't what it was 50 years ago. I think I saw the study where it talked about how many oranges from today will equal the nutritional value, the nutritional density of an orange 50 years ago.
Yeah.
And it was 12 oranges, I think it was. It was ridiculous. So, are the oranges even sun-ripened anymore when they reach the shelf? And so we have to use the supplements to back that up. But also, when someone has a disease process going on, we want to reverse a disease, we want to use the nutrition like a jetpack, especially when we have things like diabetes and obesity, where they're going to have irreversible kidney damage taking place while they're getting well. So we want to get them well quickly if we can. And we use supplements to help them get there.
Sure.
But then while they're getting well, they're learning the new lifestyle traits. And the lifestyle choices they're making now are going to be for the rest of their lives. It's not just a diet and you go on and come off of. This is a new lifestyle choice for the rest of their life. So it's worth digging in with them, taking the stitch in time and finding out what makes them tick so that you can be a leader and a catalyst for them.
Yeah.
And when they feel empowered, they're self-driven after that. But there's a process that they go through. And I think a lot of doctors that are listening to this know what I'm talking about.
Sure.
And it's what do I get off on? I get off and seeing patients get well.
Yeah, good for you. That's great. I love that, Dr. Scott. Now, as we wrap up here, let's say hypothetically I didn't have young arteries and so forth.
Sure.
What supplements, you mentioned CoQ10 and arginine, NO boosters. If you could just run down the list and pretend that I have really bad.
Okay, R-lipoic acid. Okay, CoQ10. The nitric oxide boosters, you have the product.
NO-Max.
NO-Max, and there's another one that's for immediate release, but you get the time release one. Or extended release. Arginox ER, is that what it's called?
Yeah, Anginox. Yeah.
Okay.
Yeah.
Those are excellent. And I know before I met you and became familiar with your product line, I was struggling to find a supplement specifically geared for increasing nitric oxide. It's been a challenge.
Yeah.
And so I appreciate the value that you brought to my practice in providing some nutritional solutions for my patients.
Sure.
We all need nitric oxide boosters. I put them on glutathione booster. We want to be able to get the liver to make more glutathione. It's the king of antioxidants. Detoxing is a part of the whole process, and depending upon the other tests we do here, we also do BIA testing, we do the GGT and the blood work. We assess these other components of the health picture, and what is the source of your cardiovascular dysfunction. It's realizing that the vessels are the innocent bystander. What else is going on that we need to address? And so if we address that and we watch the vessels get better, I think that would be the right approach to deal with it.
Yeah.
All right.
That's really, now you mentioned innocent bystander a couple of times, and sometimes we call it collateral damage. Do you want to explain that? Because I think a lot of people are just saying, "Oh, I have poor heart health," or cardiovascular disease runs in my family.
Sure.
We know it's probably just lifestyle. So can you explain that really?
Well, if you were a patient, I would explain to you, like you mentioned, I got cardiovascular disease in my family. I got the genes, and it's the deck stacked against me. And depending on the speaker that comes in that I have listened to. It's varied anywhere from 60 to 80% of the picture is your lifestyle. Up to 40% are your genes. So yes, if you have the deck stacked against you, it's 40% of the pie. Mm-hmm. You have 60% of the pie that you can control. And if you are responsible and you realize that you're an individual, you can't compare yourself to your wife or your neighbor or anybody. You're an individual, and this is the way it is for you, okay? That if you use the lifestyle choices and you incorporate the healthy choices into your everyday decision making, you will get there. But also, as a doctor, I need to find out why you're having this health concern. And so I always give the example because it's a real story for me, all right? When I was a boy, I dropped a bowling ball on my big toe, all right? And it was really painful. I was crying and made a big scene, okay? At the bowling alley. Well, the next day, all my toes were inflamed. And, if my toes could talk, they would be saying, what are we getting all this inflammation for? The inflammation happened on that big toe, okay? I'm the neighbor. Why do I have to deal with it, okay? Inflammation can be worse than the initial insult. And so we have to identify what that is. And so the checklist that I normally go through is first I look at blood sugar. We look at body composition, look at phase angle in the BIA test, look at the water compartments. And usually, if it's the chronic disease patient is one that we're getting into. We're not getting an acute problem. We got good doctrine requires that we sort that out first, okay?
Sure.
But once we get that taken care of, we can look for the critical point in our health and then focus in on that, and then look at the nutritional interventions that we can use to help bring that in control.
Perfect.
And that's what we're talking about here. Okay.
Yeah, great stuff.
And we talked about Dr. Houston. I mean, he has a great way of breaking it down. How many times have we heard him say, there are three primary functions of problems. It's going to be inflammation, immune response, oxidative stress, and each one of these three components has an infinite number of roads to them. Mm-hmm. And as doctors, we have to be the Sherlock Holmes to investigate what is the road leading to these patients' inflammation, immune response, or oxidative stress.
Perfect.
And that's the functional medicine world.
Love it. Dr. Scott, thanks so much for being on the show.
It's my pleasure.
Appreciate that.